Okay, welcome everyone. I am recording this webinar, but this is for the California Learning Community Tribal and Urban Indian Medications for Addiction Treatment for Opioid Use Disorder and Psychoactive Stimulant Use Disorder Funding Overview. So we are going to give you an overview of the RFA that's currently been released and the funding opportunity. But a couple of notes before we get started. As I mentioned, I am recording this webinar. We are going to share the recording of the webinar and the slides on the website, and we'll send it out as an e-blast to everyone who registered. So you will have access to those for review and reference down the line. And then we'll also stop several times to take questions. So there'll be ample opportunity. If you are able to use the chat, that's the easiest way to take your questions, and we'll make sure we answer them all as we go through the presentation. The agenda today is to provide some background on the partners and the larger project, to dive more deeply into the funding opportunity and exactly what our expectations are, and then to also go into the nitty-gritty of the application process through our online portal and review the exact questions that we are asking applicants to respond to. So our team today on this webinar, this is a collaborative project between Kaufman and Associates and the Center at Sierra Health Foundation in partnership with the Department of Healthcare Services. And Holly, Isabel, and I will be leading various parts of the webinar today. So very excited to be able to join you. A little bit of background on the center. The Center at Sierra Health Foundation is the administrative entity, the managing entity of the MAT Access Point project, which I'll talk about in just a second. But it was launched in 2012, and it brings people, ideas, and infrastructure together to create positive change in California. And really, one of the underlying tenets of the center is the dedication to health and racial equity in all of our projects and funding opportunities. And with that, I'm going to turn it over to Izzy to talk more about Kaufman and Associates.
Hi, Dr. Mayley. Good morning to anybody who's joining us today. My name is Isabel Panath, and here at Kaufman and Associates Inc., I serve as the Vice President for Training and Technical Assistance. And I want to share just a little bit of background on KAI, which was founded in 1990 by our president, Joanne Kaufman. I'm also a member of the Nez Perce tribe. And so KAI is a management consulting firm, and we've been doing work across tribal, state, federal, and regional governments and private sector businesses over the course of 30 plus years now. We are headquartered in Spokane, Washington, but we do have multiple staff who telework from across the country. So here at KAI, we also have a variety of different service lines or departments focused on research and evaluation, communications, training and technical assistance, organizational transformation, and meeting and event planning. And so we're excited to be a part of this learning community opportunity, and we're thankful that you guys were able to join us today. And before we move on, I just want to open up the floor to Holly Echo Hawk, our colleague on the phone, to see if you can give a brief introduction of yourself.
Sure. Hi, everybody. Holly Echo Hawk here. I am a member of the Pawnee Nation in Oklahoma, and I'm really happy to be part of this effort. I am a former behavioral health director, and I've worked in behavioral health for over 30 years. And for this effort, I am the Senior Behavioral Health Advisor for Kaufman and Associates.
Wonderful. Thank you so much, Holly and Isabel. And then I'm going to just give a quick overview of MAT Access Point project, because you will see this language in the RFA, you will see it in the contract agreement, and throughout the website. And so I just want to set a little bit of context of how this funding opportunity falls under that. So the MAT Access Point project is a larger umbrella program that is managed by the center. And the goal is really to fund a network of organizations throughout California that are addressing the opioid crisis by supporting prevention, education, stigma reduction, treatment, and recovery services for people with opioid use disorder and substance use disorder. and importantly, by increasing access to medications for addiction treatment. So this learning community funding opportunity is one project under this larger MAT Access Point program. So when you hear that language, or we say, welcome to the MAT Access Point cohort, that's what we're talking about. Now we're going to talk a little bit more about this specific RFA and funding opportunity, the learning community, and provide a little bit more on the program scope. So the overall objective is just really to provide funding for tribal and urban Indian health entities to participate in a learning community to start up or strengthen their substance use disorder treatment services. And under that is specifically medications for addiction treatment, for opioid use disorder, and then also treatment services for stimulant use disorder. There is a total of $2.5 million for two components of the learning community. There's the startup site and there's the peer site opportunity. And we will talk a bit more about that, but it should be noted that for this RFA specifically, for this application, it's only for the startup sites. And by startup, we mean startup and enhancement, and we'll go into that a little bit more as well. The project period would be from April 1st of this year to June 30th, 2022. So with that, I'm going to turn it over to Holly to talk about some more of the key objectives.
Sure. The primary goal, as Nora was saying, is of the learning community is to assist tribal and urban Indian health programs to develop or strengthen and sustain their medications for addiction treatment program for opioid use disorder. So that's the overarching primary goal. However, because we all recognize the concern that communities have about stimulants, the learning community will also assist grantees who have demonstrated their need and request information about treatment for stimulants, methamphetamine, cocaine, and other stimulant use. So back to the slide here, the key objectives. So there's two areas I want to touch base on. The contracts are to be part of the learning community, excuse me, the contracts are to either start up an MAT program or strengthen your established MAT program. The reason we say that is some people are they already are providing MAT services, but they're in the early stages of that. So this funding opportunity is for people who have not provided any MAT services yet, but are interested in developing that. Or if they are in sort of the early stages of providing MAT services and would like some extra support on deepening their programs, that's also a reason to apply. And secondly, as I just said about the stimulant use, if there's a need, one could also apply to develop, strengthen, or expand established stimulant use disorder treatment. The other thing I wanted to mention is when you apply, you have to remember that the primary focus is to support MAT for opioid use disorder. And again, should there be a need for stimulant use disorder, you can, demonstrate that need as well. And then the last thing I wanted to mention is, well, actually two things. Based on your application, and if you're successful in receiving the funding, a scope of work will be developed, but it will be individualized for each grantee. So it's not a cookie cutter approach. We're going to support your particular needs that you've identified in your proposal. So you'll have an individualized scope of work. You'll also have an opportunity to receive, as part of this, no cost free training and technical assistance. So there'll be someone that will be assigned to provide assistance to you in terms of technical assistance as to help you achieve the objectives that you've set out. So that's what we have for this particular slide.
Izzy, would you like to talk about eligibility?
I'm sorry about that. I thought I was unmuted. So here we have the eligibility requirements listed out, and you can also find these in the RSA as well. All applicants must be located in California and provide services in California, are an urban Indian and tribal health entity, an ability to articulate the local need for treatment services, understand the role that historical and ongoing trauma, systematic racism, poverty, and other factors of disparity have on health and behavior choices of tribal and urban Indian communities. Applicants must have available waivered providers or eligible providers interested in receiving waivers to prescribe FDA-approved medication for opioid use disorder treatment. And then the second column here must have health entity leadership, board, or council, and staff reflect the tribal and/or urban Indian communities that they serve. Recognize barriers to successful outreach and engagement in treatment for tribal and urban Indian populations. Include knowledge of local indigenous culture and staff capacity to develop culturally responsive, healing-centered, and trauma-informed approaches to treatment and recovery. And then lastly, urban Indian or tribal health entity leadership agree to support the learning community with leadership participation, designated key points of contact, staff time for activities, and cultural healing linkages needed to plan and implement substance use disorder services that incorporate tribal culture into treatment and recovery. And then regarding the funding amounts, we are anticipating about 25 awards for this learning community. And again, these are for the primary sites that will be starting up or elevating, building upon current MAP services. And so we're anticipating about 75,000 per grantee, or up to 75,000.
So if you're awarded, as I said before, this is Holly, you will have access to no cost and free technical assistance. So that's in two areas. One is with peer sites, in our support of peer sites. And that, you know, we are really excited about this learning community opportunity. And our objective is to develop a vibrant community of tribal and urban Indian culture-driven SUD providers across the state of California. And as part of that, the learning community very much supports peer-to-peer learning opportunities. We know that the opportunities for peer-to-peer knowledge exchange is a way to tap into local examples of tribal resources. There are many tribal and urban Indian programs that have demonstrated successful integration of cultural strengths into their clinical treatment practice. And the peer-to-peer learning opportunities will build on and engage these other great examples that are already in play. The technical assistance providers will facilitate a range of different kinds of peer learning opportunities so that the local communities that you represent, if you're successfully funded. So the opportunities will just provide a forum to share successes and challenges of culture, clinical practice integration with the funded grantees. Most of that at the front end will be virtual, but we also want to supplement the peer-to-peer learning opportunities with in-person convenings. Of course, that is going to be dependent on, you know, the status of public health guidance. But we really are very anxious, as we all, I know you are too, to travel again and to be able to see each other face to face. So grantees will be supported to develop peer relationships with other tribal or urban Indian SUD service providers who are experienced in the integration of culture clinical treatment, including you'll have access to tools to monitor patient engagement, re-engagement, because we know that in the patients that and clients that are served will also, unfortunately have relapse and then will rejoin the program, and treatment successes. So the peer-to-peer work is going to be really exciting. We're really happy to support that, and that'll be available again to the grantees that are awarded. Kaufman and Associates also will have a team of behavioral health folks that will be available to provide technical assistance to your community. So that team will include people experiencing tribal behavioral health and substance use disorder clinicians, an addiction medicine physician. And the other thing that Kaufman offers is a communications team. So Kaufman and Associates has a communications team that's able to support and assist and provide examples of different kinds of public education and community education materials. And then I think the last thing I wanted to say is that if you're awarded, there'll be a needs assessment that the technical assistance providers, Kaufman and Associates team, will help you develop a quick needs assessment of the technical assistance needs. And based on that assessment, we will develop a structured and individualized training and technical assistance plan. And again, this is based on what you need and what you think you need, not necessarily what we, it's not a cookie cutter approach. It's very individualized to what you think of how we can best be of support to you.
I'm going to touch quickly on the payment schedule, so you could also think about that in terms of for planning purposes. So for awarded organizations, 50%, so half of the total award, will be paid upon execution of the contract. That means as soon as we have a fully executed contract, you'll receive 50% of the total award at the beginning, upfront, and you'll be able to begin implementing activities immediately. The second 40% of the total contract award is about a year into the contract period, and it will be paid upon the submission and approval of progress reports. And this final 10% of the total award will be paid at the end of the contract period. So after contracts end, and that's also with submission and approval of progress reports and a final report. So as you think about planning in terms of when dollars and buckets of funding will come through, it will be outlined like this. There are reporting and data requirements as part of the contract for this funding opportunity. The first is quarterly progress reports to UCLA on quantitative data. They are submitted on a quarterly basis directly to UCLA via an online portal. There's also going to be a KI evaluation project with check-in surveys that's still being finalized. And there will be a final report as well, along with some intermittent financial reports, basically 2 financial reports through the final, over the entire contract period, one halfway through and one at the end. But full instructions as well as the questions will be included in the contract agreement. So awarded organizations can see very clearly what the expectations are. And with that, I'm going to pause for a moment to see if there's questions on the overview and the funding opportunity so far. And I just want to remind everyone on the webinar that you are able to ask questions via chat. You can ask questions throughout the presentations. We don't have to wait for a question slide. But if in case questions come, 2 days down the line or when you're working on your application, we will share an email address and you can ask those questions at any time. We are here to help support you in this application process. So let me pause for a second. I don't see anything that's come through the chat. So I'll just continue on because the next part is some of the application process itself. And if questions come up, shoot them through the chat or send them via email. We'll stop again at the end to take additional questions if anything has come up. So I'm going to go through the actual application process, our online portal, and then the exact questions we are asking applicants to respond to. So this is our online portal. This is the welcome page of the online portal, and that's where applicants will fill out and submit an application for this funding opportunity. We really request that all applicants, if able, use the online portal. It makes it much easier for us in terms of the review process and processing applications. However, if your organization does not have the technology to access the grants portal, reach out to us and we will work with you to figure out a different method for application submission. If you're not able to use the portal, that should not stop you from submitting an application. So if you can't use the portal because of technology or XYZ, then please reach out to us and we will work to ensure you're able to submit an application. I'm going to make this note real quick about browsers, and I will repeat it a few slides in. Unfortunately, as all of these online portals are their own nuanced, unique, finicky things, and ours in particular is a little bit picky when it comes to browsers. So if you are working on a PC, please be sure to use Internet Explorer as your web browser for the portal. And if you're working on a Macintosh and Apple, please make sure you use Safari for your browser. The portal does not like Google Chrome. I'm very sorry if that's your browser of choice, so please don't use Google Chrome. Use Internet Explorer on a PC or Safari on a Mac or Apple. And that should help alleviate some of the glitches and challenges that come from the portal itself. If you have never used the Center Grants portal before, you're going to have to create an account. The red circle there on the screen encircling new applicant, go ahead and click that and it will let you set up an account. If you have previously applied through this portal, through the Center portal, then you can just enter your email and your password and log into your previous account. Just a couple of notes in terms of submission tips for the application. Please, if possible, submit your application before the deadline date, just in case anything comes up or if you need help with any of the application components. We're not always able to respond to questions the day of the due date. So if at all possible, go ahead and submit early so that, all problems, you don't run into any problems, more or less. There is a link in the RFA. It's actually also on the screen. That will take you to initiate the application. You're only going to use this link one time to initiate your application. After you've started working on your application and you hit save, you will receive an email, an automated email with a link to return to your in-progress application. So you're really only using the link here one time to start your application. And after that, go to the email link that's sent to you to get to your in-progress application. It's just a weird thing that our portal has. If you accidentally use this link again and you come to a blank screen and you're like, I put in all of my information, where did it go? It's gone. What probably happened is you used the initiation link instead of the in progress link. So take a deep breath because hopefully it wasn't lost, and we'll just have to find the right link so you can come to your in progress application. All of the required fields in the application are marked with a red asterisk. It won't let you submit the application if any required fields are not completed, so you'll know exactly what you need to respond to. And then very importantly, you're only able to submit your application once. So please double check everything before you hit submit. And that includes making sure you've uploaded the correct attachments and that you've been able to review all of the responses before hitting submit. That email address that we will share, if you have technology issues, if something's glitching on the portal or you can't figure something out, use that same email to send us a question about it, and we will make sure to walk you through it and help get you set up. All right, so the next part is the grants portal. Once you're logged in and you've started your application, this is kind of like your home screen. This is where you'll see all of those purple tabs. that correspond to sections of the application. You can move back and forth from page to page by clicking on the tab or by clicking next there. You can save your application and come back to it later by clicking on the Save and Finish Later button. And again, as a reminder, when you save your application, you will receive an automated email with a link to return to your in-progress application. So make sure you use the in-progress application link each time to return to your application, because if you use that initial link from the RFA, you are going to just see a blank, brand new application. There is a pre-application question, like a screening question that comes up before you get to the screen. And that question is, has the organization been debarred from receiving federal funds? It is these are federal dollars that we are regranting, so it is a required question. If you answer that you have been debarred from receiving federal funds, you're not eligible for this opportunity, unfortunately. However, if you accidentally click, yes, I've been debarred, it will kick you out of the application. Don't fret if that was a mistake. All you have to do is click on the initiate application link again, and you can respond to that question again, and it will take you forward. So if you accidentally put in the wrong response to that pre-screening questions, you can just come back to that link and try again, just as an FYI. Doesn't mean you're out indefinitely. So let's go through some of the actual application. We're starting on the first purple tab with applicant information. And that is just your general background information, organizational information for the organizations that is applying, contact information, address, et cetera, et cetera. And as a reminder, at the end of the RFA, if you open the RFA at the very end, it has listed out every single question that will be asked in the application, so you can review it, you can reference it, and you can already have responses ready to go before even opening the online application. The next section is on project information. So this is the opportunity you're applying for. There's only one option. It's only startup site. And by that, we mean startup or enhancement. This opportunity is specifically for that funding bucket as part of this. It will ask you for a project name and brief description. If you could please summarize your proposed project, including key goals, activities, expected income. This is basically the paragraph that we use when we announce awards. So we go to the summary first. The project start and end dates will already be entered for you, so you don't have to worry about that. It starts April 1st of this year and it ends June 30th of 2022. You're able to enter the total requested amount of funding up to $75,000. Geography, it will be asked you to say which counties by percentage you will be working in and the counties impacted. And then focus population is a race ethnicity question. So that's the general project information that's asked. The next section is the narrative questions. And these are outlined more explicitly and provide more detail in the RFA at the end there. So there's basically a description for each of these questions and exactly what is being asked in the RFA. But here I just have the titles of each of the questions. The first one is around organizational description. It's a background of your organization, mission, geographic area, programs you operate. The second question is need. As Holly and Izzy mentioned, this is your opportunity to provide a description of the need for MAT services for OUD and/or services for stimulant treatment. We also ask for your organization's history with providing substance use disorder services with tribal and urban Indian communities in California under the track record. For use of funds, we're asking for, activities, timelines, and goals, exactly what your plan is for these funds to join the learning community. And then expected outcomes will be directly tied to those activities, your evaluation process, your organizational capacity, sustainability, and technical assistance. So the technical assistance question, it's pretty much what non-monetary assistance resources supports would your organization benefit from? It's what Holly mentioned. There will be an additional needs assessment after awards are funded. but this is also an opportunity to kind of begin thinking about what kind of technical assistance would support you in implementing the project. Now I'm going to go over the attachments, and the attachments are uploaded through the online portal on that last tab. There are a couple of required application attachments for this funding opportunity. There's the proposed Excel budget, which I will talk about more in detail, the proposed budget narrative that ties to that budget, the applicant organization's W-9, and a letter of commitment. And the letter of commitment, because I don't go into detail in the slides on this, is basically a letter from organizational leadership that includes a point of contact and designated leads. So the name, credential, and position for the MAT service planning team. So who's going to be involved in this project? Who's going to be participating in the learning community? And we want that from organizational leadership to demonstrate that there is buy-in for this project. Okay. So let's go and talk a little bit more about the proposed budget. The proposed budget is required of all applicants. And I will, in the next slide, I'll tell you exactly where to download the Excel. But this is essentially what the form looks like. There is a required template that we ask all applicants to utilize. It looks like this. Again, I'll show you in just a moment where you can find this Excel sheet under the attachment tab. But let's go through this a little bit. So on the far left is the line item columns. So in the top section, you're entering any staff that are part of the project by title, as well as any consultants. And then in the lower sections under other expenses, we provided some common allowable line items, so you can just fill those in. But we also have several blank spaces under the miscellaneous list for you to enter appropriate other expenses as pertains to your project. The very bottom, where it starts with point 3, direct admin clerical salaries, I want to talk a little bit more about because it's a little bit unique to this funding opportunity. So the first thing you should know is that indirect for this funding opportunity is limited to up to 10% of the total award. So completely separately, indirect up to 10%. If an organization is applying for $75,000, that means they may apply up to $7,500 for indirect in their budget if they so choose. The other section, direct admin clerical salaries, is a little tricky because DHCS and the team has pulled this out separately. So initially the thinking was that salaries of administrative and clerical staff should normally be treated as indirect costs. However, there are certain circumstances where they can be charged as direct costs. So those circumstances are if the administrative and clerical services are integral to the project or activity, if the individuals involved can be specifically identified with the project or activity, if such costs are explicitly included in the budget or have written approval, and the costs are also not recovered as indirect costs. So if that is the case and you would like to put direct admin and clerical salaries as part of your direct costs, you would list them there under section 3. But please note that this amount cannot be greater than up to 5% of the total award. So if you are requesting $75,000 and some of that is for direct admin clerical salaries, then you are limited to $3,750 of the $75,000 for that. If you choose not to use any of those funds, any of the up to 5% for a direct admin clerical salaries, you can roll that into data collection and reporting. So data collection and reporting can be up to an additional 2% of the total award. So if you're again applying for $75,000, it could be up to $1,500. But if you don't want to use any direct admin clerical, you can increase the data collection and reporting up to 7%. You can roll those together for data collection and reporting up to 7%. So essentially you have your direct costs, you can have indirect up to 10%, you can have direct admin clerical up to 5%, and you can have data collection and reporting up to 2% if you use the 5% for direct admin, or up to 7% if you combine those. And this is a little bit confusing. We tried to clarify it on the screen. I probably have not clarified it all with my words. But when you download the Excel document for you to use, you will see two sheets, two tabs on the Excel documents at the bottom. One is this budget form, that's sheet 1. And the second sheet is a description and definitions sheet, which talks about more details about what indirect is, what direct administrative costs are, and what data collection and reporting costs can be allocated. So there's definitions and descriptions on the Excel sheet itself if you need that for reference and review before submitting this. And where you find the Excel sheet is under the attachment tab of the online portal. So if you click on the attachment tab, each required attachment has its own little section. And so what you can see here, the first required attachment, proposed budget, there's a little blue sentence that says download the center budget template form here, fill it in, and then upload it in Excel format. If you click on the here, which is circled in red on your screen, that will automatically download the Excel sheet for you. It links to the Excel sheet. It will let you download it, fill it in, and then save it to upload it again. So that's where you will find the template we are requiring and requesting all applicants to use for the budget. For the proposed budget justification, we also provide a template if you would like, but if you have your own version that explains it, you can use your own version. So the only required template is the Excel budget. All right, pausing here for a second, because I know that was a lot of information before I provide a little bit more detail on the budget narrative. So the budget narrative, budget justification is a narrative description of your Excel budget. It is required as an attachment to this funding opportunity, and it's also uploaded in the attachment tab. Please make sure to provide detail and description for every single line item that is listed in the Excel budget. So if you have dollars in the Excel budget, make sure you have a matching description of the purpose and details for each of those in the budget narrative. This also includes FTEs, full-time equivalents for staff, and it's also an opportunity if you would like to identify other funding secured or in-kind support if applicable. And just a note on the full-time equivalents, FTE is how much each staff member that's listed in your budget will be spending on this specific project. All right, so that's the budget narrative and kind of a quick review of the application process, the portal, and the actual questions we are asking applicants to respond to. Any questions related to that amount of information that I just shared? Gonna give it just a second, but I don't see any questions yet in the chat. All right. And again, we'll stop one more time at the end in case additional questions have come up. So here's a couple of submission tips that I just want to highlight. And the first one is again to the browser. Whew, the browser is really a key component of using our online portal. So if you're on a PC, please use Internet Explorer as your web browser for the online grants portal. If you're on a Macintosh, a Mac, an Apple, use Safari as the web browser. Make sure you can click save and return later if you're not going to be active in the application. If you need to come to it later, no problem. We recommend, again, submitting the application before the deadline date. And we also recommend, particularly for the narrative questions, because there are several, to write those responses outside of the grant portal in a Word document or somewhere else, and then cut and paste your responses into the appropriate field. And that is just to avoid the worst case scenario of losing your information. So that's just a general recommendation. And there are word count limits for the narrative questions. So just take a look at those and make sure you track those as you respond. And just a quick reminder, if you save your application, you will get an automated email that will provide you a link to return to your in-progress application. If you have any questions, we're going to share an email at the end of the presentation. Reach out to us, please, if you have questions about the RFA, if you have technology questions, whatever it might be. Again, we are here to support you in submitting these applications, and we are happy and will respond to you as soon as possible once those questions are received, except for on the due date. Please, we are not always able to answer questions on the due date of the application. So if you're able to ask in advance, then it avoids the stress of trying to track down an answer when applications are due that day. All right, the checklist for this funding opportunity is take a look at the RFA. Pretty much everything that was covered here today is also covered in the RFA, including all of the application questions. Complete the application in the online portal. That is the questions, the attachments, which include the project budget, the budget justification, the W-9, and the letter of commitment. Applications for this opportunity are due March 19th at 1 p.m. And if you'll note, there are 2 tribal and urban Indian funding opportunities open at the moment. They are for different things, but their application due date is the same date and time. So March 19th should be highlighted on your calendar, and March 19th at 1 p.m. is the application deadline for this opportunity. We expect to make contract announcements in April and have funds available in April for partners that are awarded. Here is the email address. If there's any questions that wasn't answered, if questions come up down the road, please reach out to us and we will get back to you. And I'm going to leave this slide up for just a minute to see if there's any questions that came up. If anyone has anything that they want to talk about or learn more about in regards to this funding opportunity, I'll just pause for a second and see if there's anything. If you're able to use the chat, that's the easiest way for us to access questions. And then Holly or Isabel, anything to add before we wrap up? I don't see any questions yet in the chat.
No. I just wanted to make sure if people had any questions about the focus, MAT and stimulants, or questions about the peer support or technical assistance.
And it's not letting me open the chat. So actually I'm not sure if there are questions in there. If Marissa or Melina, you can confirm, are there questions in the chat?
There are no questions.
Okay, just wanted to make sure I didn't miss anything. Okay.
This is Isabel, and I don't have anything to add, but thank you, Nora, for a great overview today.
Fabulous. Great. Well, if that is the case, I will go ahead and end the webinar. Thank you, Isabel. Thank you, Holly, so much for your partnership on this. Again, if any questions come up, please reach out via email and we'll make sure to respond to you. Thank you, everyone.
Bye, everybody.